Thank you for coming on today. This is Women's History Month, and you have just made history by being the first woman on the Healthy Swag podcast. So, hey,
well, all right.
We need a round of applause.
All right. Well, all right. Well, all right. And I got the memo, the blue. Okay, and I got the memo.
Yes. We're in solidarity here. But we talked earlier. We talked last week. Didn't realize just the degrees of separation. We were all at Oakwood at the same time. Absolutely. As kids, and I guess you were a couple grades ahead of me, so we didn't interact at all. I don't think. Yeah. Were you in the children's choir with Indala? Were you in?
No, so I am one of the peoples that went to First Seventh-day Adventist Church in the city. Okay. My family is a cornerstone at First Church. Yes.
Were you there when my uncle Robert Willis was pastor?
Absolutely. Absolutely.
He is okay. So he is my godfather, and I named my son Robert Willis Palmer.
Wow.
My second son is Robert Willis Palmer. So I knew Indala. I knew the children's choir over there, Mrs. Galley. I went to Oakwood. I tell people I'm one of those poster children for Christian education. I went to Oakwood Elementary, Oakwood Academy, Oakwood College, Loma Linda University, School of Medicine. My first 2 years of residency was at White Memorial Medical Center, which is their sister institution. Wow. My first job was at Washington Adventist Hospital. And our firstborn was born at Washington Adventist.
You're the most Adventist person on the planet.
Okay. Yes. Oh my God. You win.
And it wasn't until I was talking about that with someone, I was like, oh, wow. Yeah. Wow. Okay. And then I married a pastor's child.
Have mercy. Yeah. You deep in it. Yeah.
All right. I also had Mrs. Galley, first grade.
Yes.
And then it was Mrs. Ogburn.
Miss Ogburn was my first grade teacher. What? Yes, she was my first grade teacher, and she's also one of my best friend's grandmothers. So I knew her outside the classroom as well as inside the classroom. So I couldn't get away with anything.
That's cool.
Mm-hmm. Yeah. See, I missed all that because I came in when I was, I think, third grade.
Okay.
On campus. I think I moved in the house that Isaac moved out of on campus.
You said is that the same house that Professor Dykes used to live in? Do you know?
No, it's across from the library.
Dykes Library.
E.B. Dykes Library. Yes. Okay, that's it. That's it. Yeah.
Yeah.
I remember those houses. Yeah. That was right on that.
Q was in the annex building, that little trailer with the two classrooms. He was in there.
Yes.
I remember that.
Goodness. That seems so long ago, but just like yesterday, all at the same time.
Yep. Good memories. Good memories there. But man, you are so busy right now and with a lot of good things going on. Can you just kind of tell us what you're doing? I see the International Menopause Whisper under the heading here. So tell us about yourself and what you're doing.
Sure, absolutely. So I am Dr. Lakeisha. I am an international menopause whisperer, hormone specialist, speaker, best-selling author of The Other PMS, Your Survival Guide for Perimenopause and Menopause. I help validate perimenopause and menopause women's symptoms and give them tools so that they can feel like themselves again. I do that through my concierge practice, my speaking circuit, my Amazon bestseller. And so if women want to become hormone hotties, they can follow me on all social media platforms at Dr. Lakeisha MD. I became this international menopause whisperer. A lot of people will look at where you end up, Dr. Q and Isaac, and think that's where you always were. Mm-hmm. But I beg to differ. Mm-hmm. And so I remember when the story started taking a divergent path. And so I tell people all the time, I'm from Huntsville, Alabama, came from a 2-parent household, blessed to be able to say that. I have a younger brother who actually towers over me and looks like my older brother, of course. And we would say, we could run in the house and say, hey, I want to do this. And we would get encouragement. And so when I was 12 years old and I said, I want to be a doctor, they were like, we're educators. We don't know anything about medicine. You need to find yourself around a doctor. So from the age of 13, I started volunteering and eventually got a paid position at Dr. William Hicks' office in Huntsville, Alabama.
Okay.
I was there from the age of 13 all the way until I graduated at Oakwood in 96. And I was able to see every aspect of the office. He was instrumental in getting me into the early selection program at Loma Linda University, where I was accepted in my junior year of school. So I already knew where I was going when I finished.
Wow. Hold on. I applied to Loma Linda as well, and I got waitlisted.
That's a whole nother offline conversation.
Because I got accepted to Duke, and
you did get accepted to Loma Linda.
Yeah, I guess their standards were high. I don't know, but anyway, go ahead.
We're not Adventist enough.
No shade. Maybe that's it. I don't know.
Not as Adventist as Lakeisha. Sorry, they knew you. They knew your path.
There it is.
No, so I like I said, I'm checking off all these boxes, right? And then life comes and hits you with a 1-2 punch. And my 1-2 punch was between 2009 and 2010 when I lost my father to complications from a stroke. And then my grandmother 10 months later, complications of CHF. And at this point, it is like the rug has just been ripped from underneath us. And like I said, we're a tight-knit family and we are in free fall. And at this time, we have our second child. I am just like, okay, where do I fit in the world even, right? So I'm getting therapy. I need that t-shirt that says, I love Jesus and I have a therapist too, right?
Amen. We believe in therapy. Yes.
Okay. And we're starting to peel back some layers. I'm trying to figure life out again. And it was at this point, I remember one night, Dr. Q and Isaac, I was sitting on labor and delivery. And my blood pressure was 160/110. And I remember
that's high, by the way. That's very high.
Very high. And I felt awful. And the nurses are like, do you need to go to the ER? Like, are you okay? And I was like, no, I'm not. And I remember whispering, Lord, I need an exit strategy. This is not sustainable. When my phone would go off with text messages from the answering service, I would get upset. And this was not me. I loved women's health. I loved my patients. And now I was just barely getting through the day. I was not having any patience anymore. I was exhausted for seemingly no reason. I did not want to be intimate with my husband. And y'all, he's cute. I like him. Okay.
That's important.
So I was just like, what is the problem? And yes, there was grief and there's complex grief. And as I said, I'm peeling back those layers. I'm also realizing that where I was in medicine was coming to an end. My assignment as this type of a practitioner was coming to an end. And so I took a step back, took a sabbatical. And 2 months into the sabbatical, I called my office manager and she is like, yeah. And I said, so, and she finishes the sentence for me. She says, you're not coming back. I said, no, I'm not. And this is when I started diving into what some people would label functional medicine, integrative medicine. I started digging into what was going on with myself, reading more research, trying to figure out how to help people understand their total picture. And so at this point, I'm just saying, okay, how do I show up to the world in a different way? How do I repackage this and give it to women in a new and different way? And that's when I decided not to do the OB side anymore, but to be able to be this international menopause whisperer and helping women through this phase of life, because we're realizing you are going to be in this phase for a third of your life.
Have mercy.
This is, yes.
Wow.
This is, and this is why I coined the phrase, the other PMS. because everybody understands or is familiar with PMS. Yes, premenstrual syndrome. Oh, that's when you're not feeling the best, or everybody has their own label to it. What about the other PMS, perimenopause, menopause survival? What happens and how does this show up every day when your hormones are not going as high as they used to, when your physiology is literally changing overnight and you wake up in a body you don't recognize? I say to women all the time, do you feel like you were left off an email chain? Like you were not CC'd, somebody forgot you, and you literally wake up and you're just like, this is not the body I went to bed in.
Oh, can I jump in here and just ask some really
Absolutely
basic questions?
Absolutely.
When typically does menopause start? And when you and here's a really dumb question.
No.
Does it end at death, or is there an ending and something else happens after menopause?
Oh my gosh, I love these questions because now you are accessing the teacher in me. And this is where I love to be able to say, okay, let's lay some foundations here. Let's give some definitions. So menopause, I heard another doctor say this on another podcast. She said, menopause is the only diagnosis that doctors send you away for a year and then tell you come back and then I'll give you the diagnosis. Because menopause has to be 12 consecutive months without a cycle. Not 6 months, not 9 months, not 11 months, 12 consecutive months, no cycle, and you can say you are in menopause. Now, this is where it gets tricky because the textbooks will say 12 months, that's it. That's the bookend, right? Well, what happens at 12 months in one day? Well, that's when some doctors will give you the label of postmenopausal. I stopped using that term because I was finding my patients were coming and saying, I didn't even go through menopause, or I didn't have that, because they were solely basing this on hot flashes, night sweats, or vaginal dryness. And if they didn't have those 3 big symptoms, I didn't go through menopause. Ma'am, yes, you did. Because if you went 12 consecutive months, no period, that's the definition. That is it.
Wait, I'm still confused. That's what menopause is, or that's how you get to menopause?
That's the definition.
That's the definition. So that's menopause. Okay. So that's the thing.
Okay. So it is a transition period.
It is a transition period.
Okay.
And there's perimenopause. This is a newer word in our lexicon.
Okay. Can I just pause for 1 second? Because this is good. So this is a men's podcast, and why I feel like this is so important for us to be hearing this is because many of us are of that age where our spouses are going through this phase of life, and if you are one of those spouses, it can be a very how should I say this, challenging time, confusing time. And because neither one of you know what's going on.
Absolutely.
And so I really well,
the different body was a great analogy that helped me a lot.
Yes. Yeah. But like, so for men who are like, if you could write a manual, well, first of all, definitely want to explain what perimenopausal is, but if you could write a manual for men who are dealing with, or I should say dealing with, but are living with a woman in that stage of life, what would you tell them? What advice would you give them? How can we be supportive in that transition?
And please dumb it down to the second grade level. We're not offended.
Thank you for giving me permission.
We are second graders in this field.
Thank you. Thank you so much. So if I could write a manual, this is such a great question. I would say it is as if you are now living in the world of a prank. And you're looking for the cameras because clearly someone's playing a prank on you. Because Why would somebody be so cruel as to interrupt your sleep? Why would somebody be so cruel as to make your skin feel different? Why would somebody be so cruel as to make your hair start changing on you? Why would you not feel that you can handle life stressors anymore? And why on earth would you allow us to start gaining weight as just by breathing air? Because you have women these are some of the symptoms. And guess what? There are so many more. These are the women that when we were growing up, that were labeled as, oh, they're just going through something. These are the women, oh, she's just a little touched.
And these are women saying this about women.
Yes.
Okay.
Unless they had the full blown, I'm perspiring for no reason, the full blown hot flash. Oh, she's going through the change. It's the change. And it was a whisper and it was zipped up. And for younger girls, it was like, okay, so what does that mean? How does this even look? So we're not even getting the talk 2.0. So if I were to do a manual, I would say it's almost as if you feel as if you're living through a prank, because you feel all the same things and your body's not recognizing that and it's not cooperating. So one of the biggest symptoms that I hear is the sleep. Sleep starts getting interrupted. And they're not getting to sleep or staying asleep or having restorative sleep. So the next day is gone to hell in a handbasket already. Okay. So that would be, it almost would be, the Cliff Notes version would be, yeah, your spouse or your significant other feels as if somebody's playing a joke on them.
So we can expect sleep disturbances,
Absolutely,
and maybe irritability too, because you're tired the next day.
Absolutely.
And you're not rested.
So so if I could give the definition or give you a little insight into perimenopause, that would even be better, because a lot of us are living through perimenopause, which I call purgatory. Okay. Because this can start in your late 30s, your early 40s. It can last for 5, 7, 10, 15 years before you go into menopause. And that's what most people are seeing, is this transition, like you said, Isaac, into the menopause. And so what is happening is your progesterone is not going as high and not staying as high as it used to. Your estrogen may not be going as high. Your testosterone is not going as high. Your adrenals are getting taxed, and that's your parasympathetic, sympathetic nervous system. That's your ability to be able to have resiliency, to be able to handle stress during the day and be able to say, oh, okay, I took care of that. That's done. That's over there. I'm good. I'm moving on. So for instance, and I brought my little pelvic model, so when I get to that, I can show y'all some things. But
nice.
Think of estrogen and progesterone. Think of it as, in simplest terms, as helping grass to grow and mowing the lawn. So estrogen comes and makes the grass grow nice and tall in the uterus to get ready for an egg to plop down on it. Progesterone's in charge of the lawnmower system. Progesterone hangs around and says, okay, mid-cycle, after ovulation, did that egg get fertilized? Okay, it got fertilized. Guys, we're not going to mow the lawn this month. We got to let everything kind of stay the same because there's going to be a pregnancy. We're going to leave everything the way it is. Matter of fact, because she's pregnant, we're going to bump up that progesterone because that helps with keeping a pregnancy on board. Mid-cycle, no egg was fertilized. Okay, guys, we're going to mow the lawn, but we got to wait 2 weeks before we mow the lawn, which means progesterone should hang around. And then after that time frame should start dropping so the lawnmowers can come out, mow the lawn. That's when a woman has her cycle. If progesterone's not hanging around and it's dropping too soon, that's when you can get the sleep disturbance. That's when
So
you
so
get all
what's
that.
happening? So what's happening in you said perimenopausal can last up to 15 years. So what's happening? You're slowly dwindling down on your
Yes, you
progesterone
have
and
an
estrogen.
and as you have an erratic pattern of your hormones. It's not in a
Okay.
cycle anymore. That's what
Oh,
a
okay.
cycle is. So if a woman has a 28-day cycle, a 30-day cycle, a 32-day cycle, what I'm saying is from the first day that she sees her period till the next first day she sees her period, that is a cycle. There's 28 days between those, or 30 or 32, if we're just going to use these rounded numbers. There are other types of situations where it can be different, but let's deal with the things that can be, that we can deal with in mathematical terms that can be simplified.
Sure.
So during this phase, so if progesterone goes, I don't want to stay up those last 2 weeks, I'm going to drop now, then they can have spotting and have a period. So then you can say, didn't you just have your period 2 weeks ago? And she's like, I sure did. And it's back again. Well, why is it back? Progesterone didn't hang around, which means your sleep is interrupted, which means now you're not as nice and as friendly and as cordial.
I was just going to ask you, does that affect their mood?
Yes.
Progesterone.
Okay. I call progesterone the kumbaya. Progesterone's like progesterone doesn't get as much press as estrogen.
It doesn't.
Progesterone is the one that actually will break down into these nice little metabolites, and some of them they send them to the brain and say, go in and tell her, shh, everything's okay. Let her shoulders relax. Go over there and start the cascade of events that helps her go to sleep. Then progesterone even goes to the adrenals. Your adrenals sit on top of your kidneys like little berets, and they manage your blood pressure, and they manage your fight or flight system and your rest, digest, reset system. So it goes over and it helps the parasympathetic, which is the calming system, helps it get back on board. Progesterone has a lot of jobs.
Wow, I did not realize that. Wow. Man, that's so I don't know if you gave me the manual necessarily.
I probably did.
I don't know if there is one that you can give.
I would say think of, well, you know what the manual is? The manual is understanding that men go through andropause.
Well, I was thinking there's similarities here, and we do have, hormonal changes. Our hormones dip, as sometimes as early in the 30s, just like you said here. And guys don't really know what's going on either. But like, as far as that guy that's got this situation where, there's friction, there's tension, there's, and there's no explanation for it.
Yeah.
Like what advice would you give to a man that is dealing with that it's not personal, right? Number one, it's not personal. These things are going on. How can we as men be supportive during this time?
I hear you.
I
would say no. Well, there's no way, but this is the answer to that question, because I say it to my patients. Even have the conversation. Don't just go in your corners and everybody get shut down and get silent on one another, because there has been discussion about how the intensity of the symptoms are not as much when you involve your partner and have a conversation about it. So when you say, and I tell my lady, I'm like, you've got to start saying something, like, and not only that, you have to involve them in the conversations and say, look, I'm not sleeping well, or one of the basic libido is gone. That's a huge thing. And I think sometimes women get the short end of the stick because it seems as if we just don't want to anymore. Like that's just the natural occurrence of things. No. And it's very frustrating when we're just like, what just happened? Like, oh my gosh, I don't understand this. Like the physiology has changed, the equipment has changed, everything looks different or it feels different. Something as simple as the way things feel on your skin is different because your estrogen has changed. So the tactile or the sensory input to your skin can feel different.
So
And
is sex different?
yes. So you have vaginal dryness. So there are a couple things that can be different. One, you may not respond the way that you used to respond to the initiation of having sex to your spouse or your significant other. Which means a lot of people think, oh, as soon as she's in the mood, she's going to have vaginal lubrication. Not necessarily. That's a whole nother talk about physiology. But what can happen with women when their estrogen starts dropping and their testosterone starts dropping, they start having vaginal dryness and they stop producing the necessary fluids to have comfortable sex. So you may have to talk about, hey, we may need to start using a lube. And that means nothing to the fact that I am not saying that I no longer respond to you or I no longer want to have sex with you. This is now a change in my body that we have to address so that I can be comfortable and can enjoy, and you can enjoy as well. So that has to be part of the conversation. So yes, everything is different. I mean, I'm going to be transparent with y'all. We've talked about this too.
Yep.
There are times where my husband's hands, I was just like, why are your hands so rough? I was like, why? And it was just like, what are you talking about? And I had to realize it's because my skin tactile has changed, and it can change throughout the month because the hormones are different. I had to get my own hormones checked, and I was so excited because I was like, I know what's wrong with me. I'm so excited. Like I called him and was like, honey, guess what? I have no measurable testosterone in my body, and my adrenals are shot. And he was like, I'm glad you know what that means. But we talk about it too, and we talk about it on our podcast, and we talk about how having that conversation literally made it so that we can have more open conversations. I can say things like, hey, I've heard about this in research, or this is what they're saying, and it actually makes life at this stage a whole lot better.
That sounds like something I heard on a podcast about sexual satisfaction, and that sexual satisfaction ratings were increased not with the amount of sex people were having, but with the communication.
Yes.
And it's even how you even let someone down. Like communicating that, hey, hey, Perry is messing with me tonight. I can't even
exactly.
but like I'll get you tomorrow, or
whatever
another time. So even just a simple conversation or acknowledgement, I'm not rejecting you. It's just I'm going through something. Actually increases sexual satisfaction for both the man and the woman if they can communicate. So that's very important.
Absolutely. And not only are you talking about your partner relationships, but if you have children in the house still, and now you have those of us that are probably in the sandwich generation where you're dealing with puberty and you're dealing with peri. That's an interesting combination. But just to be able to maybe have some type of conversation like, hey, I don't feel as great, or I can't now process you talking to me at the same time as I'm doing this, anymore, instead of just being, what are you saying? What are you talking about? Having just those conversations outside of the immediate situation can also be very, very helpful for the whole entire family, as well as the woman that's going through these hormonal changes as well.
Wow. So let's say you're a man and your partner has not been diagnosed yet, or you're I guess you're early 40s, I guess was when you're not sure,
right?
So this is the problem that men have, and especially if you are around on a regular basis a woman that went through their cycle, is when you start detecting some weird things happening, you want to say, hey, I think you're but you don't. When we're trained, don't say it. Look at the calendar and shut up.
Right.
How would you advise the man bringing up the conversation that has never been started. Hey, maybe.
I would
that's a
say
tough one.
that's a tough one.
Yeah.
First of all, you have to know the communication style of your partner.
Mm-hmm.
Okay.
Okay.
So
Okay.
that, I believe, is of a foundation. And it could be as simple as, hey, I may be wrong. I don't know. I'm not saying. I know that there's a lot more talk about there's a new label that has been given to be able to help us understand the transition into menopause. And it's called perimenopause. Now, the issue though, Isaac, is that I have women that go to their primary care doctors or even their traditional OBGYNs, and because of their age alone are told, you're not in perimenopause. No, that's not what you're going through. So you can have this feeling of being ignored in the medical community and feeling as if, well, I know something's going on with me, but nobody has been able to validate that. So that's where I think it becomes an ongoing conversation so that you can help your partner find the right person for them so that they can get the attention that they need. So someone like myself, by the time they come to me, they've been to a few doctors. They've been to a few.
Mm-hmm. So this is not something
too.
that they screen like that.
This is one of those things where we don't have the test, and I say this to women all the time. You go and you say, I need you to test my hormones. I was like, first of all, your whole big bag of hormones. Okay. So just to go in and say, I need you to test my hormones, it has to be more of a specific request to have a better and more engaged conversation. Because thyroid you have thyroid hormone, you have hormones coming from your adrenals, you have all types of hormones that can be tested. But if you go in and say, is there, first of all, how do you test hormones? Because you can do it through blood and your regular blood test, you can do it through urine test, or you can do it through saliva. And I say, ask the practitioner, how do they do that? And because they know what data they are trying to gather so that they can make the right decision and give you the right plan for you. So that's one thing. The other thing is saying, hey, if it is blood test, are you testing estrogen? Are you testing two types of estrogen, like estrone and estradiol? Are you testing my progesterone? Are you testing testosterone, free and total? Are you testing FSH? Do you test twice? Do you have to do this more than one time? Because some practitioners want two sets of data.
It's very complex.
Yeah,
very
it is.
complex.
It is. Yeah. It's not just go in and say, I need the perimenopause test.
No, not going to happen.
No.
Gotcha.